Welcome to Musculoskeletal. We'll begin with number 84 on your checklist. Inspect the cervical, thoracic, and lumbar spine. Be sure to indicate to the SP that you are performing this inspection.
I'm inspecting the cervical, thoracic, and lumbar spine.
Number 85, percuss over cervical, thoracic, lumbar, and sacral vertebrae. Number 86, test cervical spine range of motion.
So I need you to do what I do. Ready? Cervical flexion, extension. Take your left ear to your left shoulder, lateral, the right ear, and cervical rotation.
Skipping to number 97 on your checklist, test shoulder range of motion, while at the same time also performing number 98, palpate for crepitus.
So what I'm gonna have you do is, I'm gonna have you take your arms up like this, and then I want your arms to come down like that. Ready? And go down. Very good. Thank you.
Number 99, test elbow range of motion.
So you should take your arms up like this. And then I want you to bring your arms up like you're flexing your muscle. In and out. Okay.
She's also done number 100, where you palpate the medial and lateral epicondyles for tenderness. Moving on to number 101, test wrist range of motion.
So, you put your hands up like this. Wrist flexion, extension.
Number 102, palpate wrists for tenderness.
Any tenderness you do? Okay. Good.
Number 103, test hand and finger range of motion.
So, keep your hands out like this. And spread them apart. Good. You make a fist. Good. Okay.
Number 104, palpate finger joints for tenderness. Skipping back to number 88, perform straight leg raise. Remember, this is a passive movement.
So when you do a straight leg raise, when I raise her right leg, we're checking for tenderness in the lumbosacral area. So if I raise her right leg, if she has impingement or nerve or vertebral irritation, her pain is going to be on the opposite leg. Any tenderness on the left? And the same here, she would have tenderness on the right.
Number 89, test for hip flexion.
So to test for hip flexion, we're going to bend her knee. And the direction of her knee depends on whether or not we're internally or externally rotating the hip. So if her knee is going in, that's internal rotation of the hip. If her knee goes out, that's external rotation of the hip. Internal rotation of the hip, external rotation of the hip.
Number 91, test abduction and adduction.
AD deduction, AB deduction. AD deduction, AV deduction.
Number 92, test for flexion and extension of the knees, while at the same time also performing number 93, palpating knees for crepitus. This is an active range of motion.
So, can you bend your knee forward to your tummy for me? Crepitus there.
Number 94, palpate for medial and lateral joint line tenderness. Number 95, palpate for patellar tenderness. Number 96, examine for knee joint effusion.
So I'm going to milk distally, proximally, and I'm going to tap the patella. If you had an effusion, you would actually see the patella float. Same thing here. Milk distally, proximally, and tap.
Lastly, moving back to number 87 on your checklist, test lumbar spine range of motion.
So to test lumbar spine range of motion, we're going to go lumbar flexion, extension, lumbar bends to the left, lumbar bends to the right, and lumbar rotation.
This completes the musculoskeletal section.